as a result of foreign competition, our gross profit margins deteriorated. We had to watch every penny of overhead.
Every penny, every half penny on this product.
And the one area that was so confounding was healthcare costs.
Every employer I know, they dread the next hike in their insurance rates.
The current costs of the system are becoming intolerable.
Why are we creating an extra hurdle for business? It's tough enough out there.
We looked at opening up a U.S. operation. If I had to increase my costs by over $1 million because of insurance coverage costs, that alone would probably drive me into bankruptcy.
Why are we making it harder for people to provide goods and services to the American public while employing people and providing tax revenues?
Healthcare costs are going up 2 to 2.5% above the projected gross domestic product. So it is running away from us.
Health insurance is a really complex system.
I cannot read my insurance policy. I don't understand it. The variation in what hospitals are getting paid was more dramatic than we thought. How are the prices set? I'll wager you have no idea.
Nobody really knows what it costs, and what healthcare systems have learned is that they can charge whatever they want.
You see, there's no accountability. The buck doesn't stop anywhere.
Our current broken healthcare system is the most rationed healthcare system in the world. That's why a third of Americans don't get the healthcare they need.
Pity the poor company that's more labor intensive than us. They are going to suffer dramatically. And if they are having bad years, if they're on the verge of collapse, this is going to push them over.
We are undermining our capacity to function, let alone compete as a society, because of the rising costs of healthcare.
If I told you that every one of your employees could get the health care they need, guaranteed, that your costs would go down, everyone would pay less and get more, you might be skeptical.
Just imagine what it would mean for this country if we could cut our health care bill by 25%. Imagine what it would mean for our business community not to have this albatross around their neck. It would be extraordinary.
And now, let's look at some numbers. Let's see what a no-hassles healthcare system looks like. Did you know that the U.S. healthcare bill flew past $3 trillion last year? The result is that we have the most expensive healthcare in the industrialized world. 600,000 American families, affecting 1.4 million people, file for medical bankruptcy each year. In the United States, healthcare costs per capita are almost twice that of the next Western country, and are almost equal to that of the next two countries combined. Over 60% of all household bankruptcies in the United States are due to medical bills. Our national healthcare bill will climb from over $3 trillion to over $5 trillion in the next 7 years. Our healthcare costs have risen over 800% since 1960, while our gross domestic product has risen only 100%. The World Health Organization ranks the United States number 37, just behind Costa Rica and just ahead of Cuba. The three main problems are that insurance companies have not been able to control healthcare costs, 21% of drug prescriptions are not filled because Americans cannot afford to pay for them, and we spend more on healthcare than any other country, but get far less in return. The fix is simple. A single-payer system could operate without high deductibles and copays. A single-payer system would allow us to negotiate with pharmaceutical companies, just like most countries in the world, saving over $150 billion a year. A single-payer system will drastically reduce administrative costs. A single-payer system will eliminate the complexity of the private insurance system, reducing U.S. healthcare costs by more than $500 billion a year. A single-payer system will allow physicians and patients to determine appropriate care, not insurance companies. In 2015, the federal budget placed the cost of health care almost a third higher than the cost of national defense. Taiwan's healthcare system has administrative expenses of 1.6%, while the U.S. has administrative expenses of 30 to 35%, over 18 times higher. The United States spends 18% of gross domestic product on healthcare, compared to less than 12% for France, Germany, Canada, and Japan. Between 2002 and 2014, average family healthcare costs under employer-sponsored plans increased 250% and another 6.4% in 2015. And working together, we can fix it.